Good afternoon, friends, and namaskar to all of you. And this is a very important forum where we need to look into what is happening today and how we're going to improve the future of our young generation, building the training area in such a manner where everybody benefits, and that benefit should reflect to this benefit to society also. So today, the responsibility for me to talk something as a teacher, and how should we look into our teaching aspects? What are the basic areas which can improve the or residency or a fellowship programs, so that we do better for the future also. I would like to thank, especially Dr. Samantha for organizing and making this forum, which is so important. Teaching and training is very important. I think not only for a student, for us also, because it's a learning process which should continue, and teacher will remain teacher till he or she is also learning. So that's a very important part. Nobody is perfect, therefore we have to look into whatever theoretical knowledge we acquire or a student acquire, that has to be translated into practical specialists. Therefore, learning and teaching becomes the important bridging part in the process of making people a good ophthalmologist. I would say there are 4 or 5 important areas where teaching has been looked into. We always focus, see how many sessions we have in a surgical training areas. Everything focused on how to do good surgeries. And that's not only important thing. It is to be a good ophthalmologist, you have to be a good clinician first. Unless you can do a good diagnostic, how can we do a good surgery? So these two areas, I think we have to form the proper guidelines in a curriculum. What should be the areas of concern? How should they graduate into these steps of a clinical learning? Then how to do a training in a surgical areas. Like one important thing I realized going across the country, thanks to the election, I could go to many places in last few months, and there's a definite areas where the lack is there in the teaching programs. The institution does have a problem, but there are areas in a private sector who are doing wonderfully better than what we think also. So there has to be a good partnership between the government organizations, teaching organization with the private sector also, and that is how we can uplift the entire teaching, which is towards the super specialization. The good teachers are there everywhere, like we all are teachers, our students are also teachers. So their exposure is also very important in all areas. Like suppose you're working in a government institution, this person needs to look into other area also. Like recently I was in a AFMC, which has one of the most disciplined people we can have. And then I realized I was speaking to them, and almost more than 50% of those the senior faculty are trained in our government institutions like PGI Chandigarh and RP Center AIMS. Then they had a point of view. They realized like coming to these government institutions where patients are public makes a huge difference for them. It's a different interaction for them. Otherwise, they don't get to see a normal population of patient there. So that type of interaction is there. So we are already going to have a rotation program of students between AFMC and RP Center, so that they both realize how things are different in these areas also. I have gone through the various organizations, and we have going to accept the Maharashtra Ophthalmic Society, their request for giving some sort of you can say students coming to RP Center observership for 2 weeks. So these are a partnership we have to develop to make them good students, make them understand what is the idea of making a people working together, respect the system and human being also. I think we all pay to Professor L.P. Agarwal as far we are concerned. He was one person who thought about making training in different areas of ophthalmology. He created a department into various specialties, and that became a center. And that is the first concept which is now translated across the world. And that time only we had 18 super specialties areas. Today we are trying to look into other areas, like we are trying to have a clinic for a genetics, clinic for AI based, clinic for telemedicine, clinic for a rare disease. Those are areas we are changing this concept to those areas also. I think our teaching should focus in those areas, so the young generation think in those areas also. So these are 4 or 5 important areas which we talk about improving bedside teaching, which has been the right from the Gurukul days. Like the teaching used to be, in association with the interaction happening between a student and teacher. That can only happen if you have this system where patients are admitted, you have patients with you, and residents work up your patients, and there is a discussion between themselves as a group discussion. Then your preceptor, maybe a senior resident, looks into those cases, discussion. Next day morning, the faculty takes a round, and this is basically potentially improving the knowledge and the confidence of students, because we say like a student facing the faculty in the rounds like an examination for them every day. If they then understand this, then our clinical teaching becomes better and better. And actually making the plan is also very important. This is what we do in RP Center, improving the bedside skills, procedures, clinical reasoning, and making confidence amongst them also. Today, I think this is a very important slide, the group discussion. If you see now, NEET is one of the major way to get people into a educational system. So if you have a 10 student, they may be from a 10 different places. Some may be from South India, some North India, some East India. They come from different backgrounds, and they are placed in metro cities. This group discussion, making friendship amongst each other, learning from each other, and also bridging the differences which can happen. So we have to build that idea of making people comfortable in that group, and that also is very important. As far as we are concerned, if I see I have to read some technique of, let's presume, how to give an intravitreal injection. If I read the books, it might take me 2-3 days to understand how it is to be given. If I have a group, my senior will immediately tell you do this, and within a minute I'll know how to do it. So this is like a better than Google in that fact. It gives a confidence, my senior does like this, I can do also. While Google will not do that, because it will tell you how to be done, but actually how it is done is by the individual itself. So this is a benefit we looked into. Most importantly, we look for improving the skill, especially facing the public. And if I tell you my own background, when I came, I could not speak a single sentence of English when I joined my medical education. But this group discussion, being together, made me feel confident I can face the public also. So this is what is important in a teaching area, and teacher will be a person who can get their student to come, and that can only happen we appreciate their skill, their knowledge, and especially giving them the importance. Like suppose somebody done a good diagnosis, you should say, okay, very good, today you have done a good job. That type of you can say words does give you and your student thinking they'll do better also in future. Medical record keeping is very, very important area. These are two important areas we are looking for future also, and this is going to be a part of our teaching, because this has to be there. Surgical training area, only thing I like to highlight here is any medical college where postgraduate teaching is be there, you need to have a wet lab training lab in those areas compulsorily now. And in future there will be a dry lab areas also. These two things has to be there in all the colleges. And recently I realized, apart from the goat side training, people demand now simulators. And various RIOs people have requested us to get something for our simulators to be given to all the institutions. I'm working on that. Maybe I can get through the NPCB simulator to all RIOs to begin with. And that is needed. I think we need to work on those areas. This all know how to go through these training areas. A faculty or a teacher would be with the students, explain them in our wet lab areas, see their videos, train them, and making people to understand. I think I'll end this line, the teacher would be such, who learns from his own mistakes or has seen the mistake done by others. So that is also important for students also, because they have an opportunity to see people doing mistakes, and they learn from that, rather than they creating the mistakes. For them, two things are important. One is making them aware things can be done. Second, giving them the infrastructure which needed for them to learn. I think today there is a definite mandate from government side to give an infrastructure to all the institutions where postgraduate teachings are happening, where the super specialist training is happening. If government cannot provide, you have to have a collaboration with other institutions, collaborations with the private sector where things are there. So that has to be looked into. I think that would be the day where our students will have benefited by our approach also. Thank you for giving me this opportunity, and thank you all of you. Wish you all the best. Work hard and let students become our teachers. Thank you.